Sometimes it seems the answer to some of life's problems are right in front of us. What if I told you combining the flu vaccine with a surprising medication already out there in the market? Well, together they could treat cancer. Check this out. For decades, scientists have tested many different medications in hopes of curing one of mankind's deadliest enemies, cancer. Well, recently, one very surprising combination may have paved the way for treatment, mixing an inactivated flu vaccine with erectile dysfunction drugs. Canadian researchers tested this mixture on mice with lung cancer and couldn't believe their findings. They found that after cancer surgery, the body's immune system is left suppressed, and that sexual dysfunction medications may actually help strengthen the immune system and help fight off lingering cancerous cells. But that's not all their findings revealed. When combining those drugs with the flu vaccine, there was a 90% reduction in the spread of the disease. These scientists were so blown away by the results, they're now putting a human clinical trial together to explore their findings even further.
Exactly, the wow response. And to talk through this, we have oncologist Dr. Piro join us. And just to remind everyone, this study was on mice. The wows are throughout the crowd. I'm sure people at home are feeling the same way. Is this as groundbreaking as it sounds?
Well, Travis, I think this is a super interesting study on lots of levels. The first is that if you ask just ordinary people that you see as patients about surgery, there has been a long-standing wives' tale, doctors have thought wives' tale, that if you take the tumor out, it's going to make it spread. I'm sure you've heard that from patients, right? And so one interesting thing is that there is now immunology that says that's probably true, and yet doctors have been saying that's the wives' tale. This particular study is playing upon that. So the immune system is this incredibly delicate balance. You need to kill the things that are foreign to your body, but not kill the body itself, right? We don't want them to attack our heart or our liver or any of that. So there are cells that are in constant balance. We have natural killer cells that are meant to kill virus-infected cells and to kill cancer cells. And then we have these other cells called MDSC cells. These are suppressor cells, and these cells pull back those killer cells when they're getting too aggressive. It turns out that cancer surgery, or surgery in general, seems to stimulate the suppressor cells that causes them to pull back the killer cells, and now the killer cells aren't killing the cancer. And so what happened, these researchers found that the erectile dysfunction drugs pull back those suppressor cells and stop them from inhibiting the natural killer cells. The flu vaccine, because natural killer cells kill virus-infected cells as well as cancer cells, the flu vaccine stimulates the natural killer cells because it's a virus stimulation, and now you've pulled back the suppression, you've revved up the NK cells, and now you kill cancer. And they used a mouse model, again, this is just all in mice, a mouse model, where they saw a certain number of metastases spread de novo. They did surgery. It increased it dramatically from, I think, 37 up to 127 metastases. Then they added the erectile dysfunction drugs, and those reduced it. And then they added the flu vaccine, and it reduced it all the way down to 11 from 127, 90% reduction.
So just so people can understand, so that we're clear, what they were looking at is how many secondary tumors you have after that initial surgery. So as Dr. Piro was very elegantly pointing out, the idea is when you take out that primary cancer, it pulls back your immune system. That surveillance that usually keeps these tumors in check is temporarily sort of stunted, and this can occur for 10 days or even months. And so now you're fueling those natural sentinels and guards of your system, the natural killer cells, to go back and get rid of those metastases, so the secondary tumors after that primary surgery.